Welcome everyone once again. Actually, the meeting ended. I think the host, when trying to make me as a host, the meeting ended. Sorry for the inconvenience.
Already made.
Okay. Thank you, sir. Thank you. Sorry for the inconvenience, Dr. Sumana Kumari, madam. I made you as a co-host. So we'll begin the meeting. I already introduced Dr. Sugam. Madam, you can unmute yourself and talk. So,
today, thank you, everyone.
Inspiration.
Thank you, madam, for a nice introduction.
You're welcome, please.
So, first of all, I must wish the happy International Women's Day to all lady doctors and today's gathering. So, good evening, everyone. Now, straight coming to my topic, we are already 5 to 6 minutes delayed due to the inconvenience. So, going to the topic, I'm sharing my slide.
Okay, madam.
Is it visible now?
Yes, palliative care of cancer.
Yes. So today my topic is on carcinocin. On 15th February, I had talked upon the carcinocin case, first case on infertility, which was prescribed with carcinocin and gut fertility. Next, today I will go for the next case of palliative care of cancer with carcinocin. Carcinocin already we had discussed in last session. So what is about carcinocin? What are the symptoms? How fastidious, very sincere, very workaholic, and the anxiety with a revolutionary attitude, grief. So all these things already we had discussed with a past history and a family history of cancer. So many more symptoms already vividly discussed in last session. Today I will straightway go for the case. So two cases today I will discuss on the cancer cases, palliative care. First, I will go to a case of high-grade glioma. A 70 years Hindu male was suffering from high-grade glioma and he presented me with the complaints in June 2024. First, I must say he was very weak. We can say triple plus, fatigueness triple plus with that patient. Okay. Frontal headache, dull headache, aggravation in evening, and he had hiccup, aggravation eating after. Convulsion was the major issue in that case, and very frequent convulsions when intensity which was so too much. And convulsion aggravation before eating or while eating. Episodes mostly once in a week he had, and frequency was increasing and intensity was increasing in every week. What he had the intensity, what he had the frequency before 1 month, that was not there, that has increased. And he had also hearing impaired and vision was also affected. Due to great weakness, he had trembling of the right hand while grasping anything, dragging gait of right lower limb and a limping gait. Bowel habit was constipated. But for last 1 week when he presented me, he had ineffectual urging with a diarrhea and frequency for urination was too much day and night. Sudden urging was there and urine was escapes out if he attended, not immediately attended. Pain both the feet, soreness, weakness was a double plus, both physical and mental, much fatigueness was found in that case. So MRI brain, he brought me the large T1, T2 heterogeneously enhancing lesion. The lesion was 52 into 50 into 44 millimeter, with affecting the left gangliothalamic region and adjoining frontotemporal lobe. Gross perilesional edema, mass effect with a partial effacement of left lateral ventricle and compression of the midbrain, and midline shift of the third ventricle was also found 9.5 millimeter to the right, and mild basilar invagination indented on CV junction. So this is the MRI report of brain. You can find that the impression it is written, the size of the lesion was 52 into 50 into 44 million with areas of gradient blooming involving left gangliothalamic region and adjoining frontotemporal lobe region. So this MRI report along with all the blood tests, routine blood tests reports he brought to me, and but the remarkable was the MRI report from which they had diagnosed about the high-grade glioma, and that is glioblastoma. Here you can find this is written as the high-grade glioma. Features like suggestive of a high-grade glioma. The MRI brain report turned like this, high-grade glioma. In case of adults, we know that the high-grade glioma is usually malignancy of grade 4 or glioblastoma. So that is the prognosis is not so good in that case. So here, physical generals, coming to the physical generals, chilly patient, resistant to cold, desire non-veg sweets, and stool diarrhea for last 1 week, urine frequency was there. Coming to really the person was of 70 years, he was a priest in a Hindu temple. His routine work is to get up early morning and to go to finish his daily routine, and he goes to the temple by 5 o'clock, and he was doing puja throughout the day, and in noon hour he comes home for 1 to 2 hours, and again he goes to the temple, and by 9 o'clock he returns. He was returning home and take dinner and rest. So in that case, he was very happy with his job, and he was very sincere in his work, very religious in attitude. But the irritability came to him when he found that he is very weak, not able to do his daily work, daily puja, all the priest worships of God, when he couldn't do. In that case, he was regretting a lot, but physical health was not permitting him to go to the temple, and he was not able to walk. He was not able to stand at that time. So that's why he was unable to do his daily worship. That's why he was very unhappy due to that reason. Gradually, irritability aggravated. Beforehand, also due to some problems, family problems, he told me that uh, the son told me that he is becoming very irritable. When I asked him, I also observed some irritability with him, but he couldn't say anything about why he is becoming so irritable. He told me, no, I couldn't do my worships. That's why I am not feeling good, and I am very much feeling bored. Okay. So very irritable coming to mental generals, and he was not expressing uh, more sentence at that in that first visit. So very impatience. What the son told, I took and I some observational symptoms I had written, but and I collected the symptoms from his son. So reproaches others that why you brought me to, why you have brought me to the doctor. Um, I was unable to do puja. That's why I am suffering. My suffering is due to the God's curse. So like this, delusion, wrong support, he says, and hurried. What he says that I couldn't do. That's why I am suffering. And the doctor, the allopathic doctor, what he gave medicine after that, I became very weak. So that could be the cause. So like this, he was expressing some little and very horrid in his work, what the son told. but this is not an observational symptom, and very fastidious, what he told, and an extrovert. So these are the symptoms from observation and from the son in past visit. So basing upon this, in past history, he had brain malaria, piles, convulsion after grief. So history of convulsion was also there, and now it has increased a lot. And anger issue was always with him, and previously too much anger he had. So gradually after worshipping, the anger issue reduced to some extent. So coming to family history, mother had asthma and his father had stricture urethra, sister had asthma. Coming to treatment history, he has already taken allopathic treatment with so many doctors and homeopathic treatment also. He had taken Cupromed 0/2 to 0/8, Artemisia vulgaris 30, and GBM 30, ginseng 30, zinc valeriana 0/2. What the prescriptions he brought to me. In the first visit, his thyroid stimulating hormone level was 0.796 and not 0, which is 796. So basing upon the as the glioma, high grade glioma, so you can say the lesional prescription I had made with plumbum 6 and along with calcarea fluor 6x BD dose. So next after 1 week, there was no convulsions within last week, other complaints as before. And he brought me the fresh all blood reports, routine test reports, blood calcium, ESR. ESR was a little bit increased, hemoglobin and vitamin D level was a little bit reduced. Other normal chest X-ray and ultrasound, everything was normal. So basing upon these reports, I had given vitamin D once in a week, 60,000 international units, ginseng Q15 drops BD due to great weakness, and alfalfa Q15 drops BD dose. So after 20-25 days, the patient came to me with no seizures, no constipation, trembling reduced 10%, but weakness was there, and I repeated the same prescription with the plumbum and the alfalfa ginseng everything. Next, again after 1 month, the fits relapsed. He came to me, the convulsive attacks relapsed, and you can mark that in June once, in July once, but in August he had 3 episodes. 3 episodes. So falls down suddenly with clenched fingers, unconscious, weakness, taciturn after attack, sleeps and wakes up early also. Convulsions, aggravation eating while, weakness improved to some extent, no headache, appetite was good, stool clear. Blood pressure was 120/80. Normal pressure, always I had seen normal blood pressure. So as beforehand he was improving with Artemisia vulgaris. So basing upon that, I again went for Artemisia vulgaris 30 TD doses with calcarea fluor 6x, alfalfa, ginseng and caliphos BD doses. So again after 1 month. So fits, convulsive attacks aggravated, so both frequency and intensity. Conscious patient was these attacks with consciousness. Okay, salivation was there, bursting of mucus with a peculiar sound. This is very peculiar. Aggravation usually after midnight, after usually by 2 a.m., 2:30 a.m. like that, 3 a.m. like that. A peculiar sound he will make, and but not so not noisy. A sound was there, but he was not shouting at that moment. That's why the person who was sleeping near him, only he was able to know that he is having the convulsive attack. That's why he gets up and he calls other members in the family to get up in that condition, pain lower limbs. So in that visit, only I was able to talk to him and he interacted with me after 2.5 months. Open discussion was there and I got these informations from him that elements from grief, anger, very much disgusted. He has a feeling of really he has a very good dignity in his society as the priest of the temple. But his younger son became alcoholic. So after being alcoholic son, he was feeling very much depressed, very much disgusted, with great anger, irritability aggravated, with helplessness feeling, a low self-esteem. He was feeling as if humiliated. Nobody was saying him anything, but still then his feelings made me a very low. The low self-esteem. So that's why he was in a grief always, irritability too much aggravated. So in that condition, gradually he became very introvert, and but his again I found by interacting with her a more time, I found that he was his selfish, not helping others, and very limited friends, duty, very committed personality, and very workaholic. To him the duty is his worship. Okay, he was doing his duty, the worship of the at the temple, is a priest work. He was doing very sincerely with the devotion, with all devotion. So fastidious in work, time, delusion. Always he was saying that I was not doing my work. That's why I am suffering. So delusion, mistakes committed. But he was not thinking that he is suffering. He was not knowing. Till today, he is not knowing that he is suffering from malignancy. That's why always he was saying that I am suffering because I couldn't do the work of the, I couldn't serve my God, my Lord. That's why I am suffering. So a very responsible, takes too seriously, and inferiority feeling within himself, inability for mathematical calculation, he was very inferior in that aspect, and elements from disappointed love, possessiveness, all these things he had in his uh, mental generals. So then in this visit I went for after these mental general symptoms, I went for reporterization. From reporterization, after reporterization, I went with carcinocin. So carcinocin 200, I went with 100 ml fractional doses, diluted doses, 1 teaspoonful once daily. One dose added with 100 ml of distillator, aqua distillator. And Baretacar, I gave him 6 in weekly one dose. And cuprum, not here. Yes, cuprum made 30 also I added twice daily for the convulsive attack, and along with alfalfa and ginseng. Next, again after 1 week, vitamin D increased 82.33, TSH was 0.7 something. Now that became 1.27, and other parameters were quite normal. So in this case, no weakness at all. So after giving carcinocin and Viratacar, no weakness at all. Gait was quite normal and able to ascend steps up to first floor. Who was not able to, very difficult work was there. No trembling of the hands. But in October, he had 3 episodes of seizure of lower intensity. But those seizures continued for 10 seconds. Okay. So in that case, blood pressure reduced. So in that case, again, I continued with the cupramate 30, calciraflor 6x, carcinocin, Baretacar. Baretacar, basing upon the lesional prescription, basing upon the nosological prescription, and the carcinocin is constitution, and to reduce the, as the with carcinocin and Baretacar, the convulsion didn't reduce. So that's why I have added cupramate 30. In this case, BD, not continuously throughout month, for some 1 week. I was giving again gap for 15-20 days, again after for 4-5 days, again gap for 15 to 20 days, like that. So I had continued for some months. Again after 2 months. So trauma, he had trauma on head and face due to vertigo. He was moaning quietly and frequency aggravated. Daytime, convulsion, clonicity of extremities, salivation, had 2 episodes of seizure, aggravation, eating after. Aggravation, eating after. And frequent urination for 3-4 days. So again with these symptoms, he came to me. That's why his son told me, Madam, he had trauma due to vertigo. Might be that might be due to the convulsive attack he has done. So the tumor size might be increasing for last 5 months, already 6 months nearly. We were treating, so now we have to go for MRI, and I also advised, let's see what happens. So again, the MRI brain was done on 30th November 2024. So at that time, we found that this is the 5.8 into 5 into 4.6. We can find the size of the tumor. You can find here, that is 5.8 into 5 into 4.6 centimeter. So it is more or less, it is not so much increased. Previously it was what we find in the first case. Here we find 52 into 50 into 40 millimeter. And now we find it is 52 has become 58 millimeter into 50, breadth is 50 same, and this was 48 and this is 46. So the height somehow reduced to some extent and the length little bit increased. So more or less similar. Not like high grade gliomas are increase of the size. The glioblastoma size increases too fast. So in comparison to that, after 6 months, that was the February MRI what he brought to me in June. So in comparison to that, the size was not that much increased, but it was there. So again with this, I continued the same medicine. But in 29th December, the patient told me that had fits with a shouting, noisy respiration, roaring, screaming sound, very much. So that's why the son called me by night, uh, not morning, early morning by 6:30, 7 o'clock, told me that so much roaring sound he heard during at night on 23rd. Again on 24th also, see, he had the same situation. And the convulsive attack continued for 10 minutes. Fell down inside the bathroom with involuntary urination during convulsion and unconscious. So the convulsive attack aggravated during this period. That's why basing upon this, second reporterization was done, and hyoscyamus 200. I stopped cupromate at that time and I went with the hyoscyamus 200, fractional doses twice daily, and Califos 6x twice daily. Again in January 2025, had fits attack on 12th January 2025 and fell down from standing position again. Weakness too much after attack and convulsion, aggravation, convulsions after, weakness aggravated after convulsion, and frequency aggravated at night 4 times. So he has to go for frequency aggravated at night. So I went with a carcinocin and a hyoscyamus in diluted doses along with the Califos 6x and Calcarea Fluor 6x. So had fits attack with loud shouting again in March 2025. Loud shouting was there. So unconsciousness, I went from carcinocin 200 to 1m and hyos 1m also with diluted doses along with alfalfa, ginseng, Calcarea Fluor 6x and vitamin D again repeated. In August 2025, that was continued. In seizure on 5th July 2025 was severe. And on 14th, severe seizure with fell down head injury. And on 1st August also, mild attack, clenched fingers, unconscious, sore injury like this. So after that, I thought, why he fell down? The severe attack weakness, you go for the routine tests, all electrolytes. So with that, we found that the sodium level reduced at that time. Okay. So that the normal is above 136 and that was 133.6. Might be due to the sodium level. He was suffering. He was falling down from the in standing position. So that's why I advised him to admit him in a hospital and go for sodium. So again, he at that time really his friend who is a onco oncologist, when he visited his son visited his friend, he asked him that whether your dad is alive or not. So and the son told, yes, he was too good. For last 1 month, 1.5 months, he is suffering from weakness and he is falling down. Now his sodium level is less. So that's why madam advised to come to you, and he was plasma sodium was given to him. After that, he became the strength revert back, and yeah, I went with carcinosine 1M and HIOS along with arnica. Natramur 6X I added as the sodium level was very much hampering. So I added Natramur 6X, 4 tablets BD. Again after 4 months. So he came to cramps in right extremities, aggravation from cold attack, seizure on 2nd October and 26th November, frequency reduced, aggravation night, sleep during, unconscious, sleepiness in evening, but sleepless at night, screams, grinding of teeth, bites during anger. Anger increased too much, and screaming and grinding of teeth, he was biting others during that period, and seizure reduced, cleansed from all these things, but anger too much increased. So basing upon this, with to some extent weakness also, I went with stramonium. I stopped HIOS and I went with basing upon these symptoms, along with carcinosine 1M diluted doses. Stramonium 1 was given along with alfalfa, ginseng, and natramine. In past January 2026, he came to me, seizure frequency reduced, had one episode in between. Only one episode he had from in December, intensity reduced, but he developed dysarthria. The speech was fumbling and numbness, motor paralysis to some extent of right extremity started. What the doctor advised him in March 2024, that within 3 months he will develop paralysis. He will develop paralysis and lifespan is hardly 6 months, was advised in February 2024 to the patient. He developed, now he is suffering from hemiplegia, but that was very clear in February 2026, but started to some extent in January 2026. In last part of December 2025, he developed. So after 1.5 years of treatment, he developed hemiplegia. He developed hemiplegia, but which was the doctors in allopathic system were told him that within 3 months he may develop paralysis, and the vision and the hearing problems were standstill. They were not aggravated within last 1.5 years. Okay. So I went with stramonium, alfalfa, ginseng, natramur. And again in 5th February 2026, he came to me, no seizure, anger easily, this time his son came to me. He couldn't come. Okay. So aggravation at night, screams, grinding of teeth during anger, bites again, sleepiness in evening, but sleeplessness at night, right-sided hemiplegia, involuntary stool and urine. Was unable to know the urge, unable to feel the urge that the sphincter paralysis was happened. That's why I went with stopped stramonium, no seizures. I went with a causticum 1 m fractional doses along with a carcinocin, alfalfa and calcarea floor 6s. In this month, 5th March, 5th March. So today is in last Thursday only, his son came to me and he told me that no seizure and hemiplegia is improving. Now he is trying to stand up from the wheelchair and urging for micturition he is feeling and able to control urination. The medicine is repeated. Now I will, this is the his son and he has sent me a video.
My name is Sushant.
I think there is.
So his son is saying that within one month, one to 2 months, drastically the energy level increased. He was able to stand up, he was able to walk, he was able to ascend steps up to first floor, uh, his son is saying that it is drastically improved. You can say 90% improved within 2 months. And after that, the convulsive seizures also for last in October he had one seizure, in November one seizure of lower intensity, and in December, January, February, and he had no seizure. He is having no seizure, and the paralysis also he developed, but in March, December last part he developed, but in February onwards he is developing, he is improving, he is trying to stand up, and he is able to control the urination. So his son is very happy really, because he has, as he says, throughout Odisha, many more doctors he has visited within March to June. After that, he came to us homeopathy, and he is improving like anything. And all the family members are very happy. If we will go to the high grade glioma, that they are very aggressive, fast growing cancerous tumors arising from glial cells in the brain or spinal cord, primarily categorized as a WHO grade 3 or 4 glioblastoma. They are highly invasive, often difficult to fully remove, and frequently uh, they are very worse conditions. These conditions are becoming frequently very worse. Prognosis is very bad in these cases, and the lifespan maximum goes up to, according to the modern medicine, maximum up to 6 to 8 months, like that. So in this case, the patient is surviving till today, and with very least suffering. For last 1.5 years, he had very negligible suffering of convulsive attacks, but uh, gradually is improving from hemiplegia also. Treatment typically involves a combination of surgery, radiotherapy, and chemotherapy, and this patient not gone under any condition. No surgery, no radiotherapy, no chemotherapy. I think one or two oral chemo or like that he has started. After that, no, he has not taken anything. After that, he has gone to a homeopathic doctor, and he was improving, but not drastically. Then he came to us with a generally poor prognosis. Although research continues to improve therapeutic options. Key aspects we see: the most common high-grade glioma is glioblastoma grade 4, which is the most malignant primary brain tumor in adults. What are the characteristics? Characterized by rapid growth, high vascularity and ability to infiltrate surrounding healthy brain tissue, making complete surgical resection challenging, a very challenging one. Symptoms. Symptoms are often sudden or rapidly progressive depending on the tumor's location. Common signs include headache, nausea, vomiting, seizures, what we are finding here. Personality changes, what we find also. Memory loss, in this case also in the beginning was there memory loss, but gradually he improved in his memory. And focal deficits like weakness of vision. And here also we find hearing and vision to some extent affected, but with beginning for last 1 year 8 months, it is in standstill condition. Diagnosis primarily diagnosed through MRI scans. Here that is done through MRI scans. So palliative care with homeopathy benefits we have got: energy level recovered within 2 months, physically fit and mentally stress free, daily routine with a normal diet, sound sleep, and now up to December 2025 he was able to ascend stairs up to first floor, and no increase in size of the tumor after beginning of the treatment, and no other comorbidities up to 1.5 years. Now he developed hemiplegia, but that is also improving, and we are continuing our treatment now. So this is one case. Really, I had 2 cases, but for another case, it's no time. Time will not permit us, I think, madam.
We have 15 minutes more.
15 minutes more.
Yeah.
Okay, okay.
9:30 we can take.
So we can go for this. We can go for this case also in carcinocin. This is a, but that was a very, really glioma, high grade glioma is a very difficult case. This case also, this is the known case of second case. Today's second case, this is known case of papillary carcinoma, left lobe of the thyroid, Bethar's 6. Left lobe solid hypoenhancing nodule. Oh, I think. Oh no, this is the case. 88 years male. Presented us in 3rd November 2024. In both the cases, all address, all phone number, all documents are with me. Okay. So hoarseness of voice, chronic. This case also 88 years male. He presented with hoarseness of the voice, chronic hoarseness of the voice, aggravation head bath after, cold bath after, and relieved in evening. He had sneezing, aggravation warm room, relieved in open air, pain, cramps in right thigh muscles, aggravation stool during. He had developed emaciation. Fatigueness was a triple plus. Too much fatigue in the beginning. He has undergone twice cardiac bypass surgery in past, and aversion to food. When he presented me, he has aversion to food with fatigueness double plus, and baldness was there. Known type 2 diabetes mellitus and hypertension was continued under the allopathic treatment, and for after bypass surgery also he was continuing with some drugs. Okay. So the investigation reports he brought to me: known case of papillary carcinoma of left lobe of the thyroid, Bethar's 6, left lobe solid hypoenhancing nodule with a large nodular calcification almost involving the lesion, multiple enlarged left jugular chain, left 1, level 2, 3, 4. Supraclavicular lymph nodes were also affected. That means metastasis already done. But no metastasis to lung parenchyma and no axillary or mediastinal lymphadenopathy. That means the cervical lymphadenopathy, the lymph nodes already affected, metastasized, but no metastasis to these things. And again, I found also here, it is not mentioned, that a hard had swelling on the, in the left side, left submandibular region. A hard nodule I found in left submandibular region. That is not mentioned here by mistake. So this is the coming to physical generals. Hot patient, desire meat, milk, sweet, fast food, and appetite was decreased. Stool hard, constipated, sweat increased. That means this case basically papillary carcinoma of left lobe of thyroid, but metastasis to cervical lymph nodes and the left cervical, left submandibular gland. That is a hard, very stony hard submandibular gland. Coming to mental generals, ailments from grief, suppressed anger, very fastidious in his work, sympathetic, affectionist, a perfectionist, a man of perfection. At the age of 88, he was very sincere in his morning walk, in his evening walk, in his pranayam, in helping others. So in all these things, suspicious to children, anxiety for health issues, and very religious. In past history, he had block, open heart surgery, and the stent was given. Family history, father, brother, sister, all diabetic. And he was a retired railway superintendent in his time in a administrative post. He has worked and continuing with allopathic system. When he brought to me, weakness was too much. So from after reportization, I went with a CARCINOCIN 200 dose in diluted doses, once daily, 1 teaspoonful once daily. And along with that, I went with R-Iod 200. As the sneezing, all these things were very acute. That's why I went with this. And first thrice daily, then once daily. And calcarea floor 6x, I continued in TD dose, alpha Q, and ginseng, as the weakness was triple plus. And aversion to food also was there. On 29th December, he improved, weight was 62 kg, blood pressure 154/86, and feeling very happy. Just within, you can mark, within 3rd November, and the next visit is on 29th December. He was feeling very happy. Within 2 months, the energy level recovered drastically. So again, the sneezing, all these things were stopped. That's why R-Iod was stopped. And I continued with the CARCINOCIN 200, calcarea floor 6x, alpha, and ginseng Q. This is the ultrasound report. You can mark that poorly outlined hypoechoic nodular lesion in left lobe of thyroid with a large calcification could be neoplastic nodular as well. So the nodule poorly outlined lesion was 2.8 into 1.5 centimeter in left lobe of thyroid. And this is the CT scan face and neck. Here you can find the lesion measures, thyroid lesion measures 19 into 17 millimeter, and multiple enlarged left side level 2, level 3, level 4 lymph nodes are affected. Here the impression we can see that left lobe of the thyroid is papillary carcinoma, CT scan report, and multiple enlarged left jugular chain level lymph nodes, okay, supraclavicular lymph nodes. Here the FNAC report, the salivary gland neoplasm of uncertain malignancy potential. The neoplasm also affected the salivary gland. So I told you the left submandibular gland, the salivary gland was also affected. The FNAC was done from that, and it was also found that is also neoplastic. This is the cytology report. Features are suggestive of papillary thyroid carcinoma with metastatic left cervical lymph node, Bethesda category 6. So category 6 is definitely of a higher category. Next, on 29th June 2025, hoarseness of the voice, aggravation morning, causticum 200, 3 doses 1 hourly with a calcarea floor 6x. So fever running up to that from December to June, that prescription continued. That is the calcarea carcinocin, carcinocin 200 with the calcarea floor 6x, alfalfa, ginseng, like that. Okay. But in June 2025, hoarseness of the voice again aggravated. I went with the causticum 200, 3 doses only, followed by calcarea floor 6x. Fever, all these things. Again, I continued with the carcinocin, calcarea floor 6x, and causticum 1m, 2 doses in 1 hourly in 15 days interval. In August 2025, causticum 1m, 2 doses 1 hourly in 15 days interval, and carcinocin 1m, 2 ounce fractional once daily. In 31st August, again same thing repeated along with alfalfa. 28th September, the complaint was not relieved, the hoarseness was as before. That's why I continued with causticum 1m once in a month and thyroidinum 1m, 2 doses once in a month. So in 15 days interval, I continued. Thyroid 1m, 2 doses 1 hourly, after 15 days causticum 1m, and again after 15 days thyroidinum 1m. But carcinocin 200 continued as before in diluted doses. In 1st January 2026, in this year, the hoarseness of the voice, cough occasional, aphthous ulcer inside the mouth, and pain right hypochondrium occasionally, soreness of the joints, body ache, malaise, all these things. He brought me the CT scan neck, cardiomegaly, with left thyroid lobe, coarse nodular calcification, evidence of extrathyroidal extension, and multiple enlarged left cervical lymph nodes. Already it was there, 2, 3, 4, and 6. Already it was there, just like that. But here we find the largest one measuring 21 millimeter. That means, so metastatic nodule. In CT thorax, we find a new thing, that is a subpleural pulmonary nodule of 4.5 into 4 millimeter. In left lower lobe, non-specific in appearance. That might not be, but the outline is very not irregular. Margin is not very irregular, might not be cancerous. What the doctor told, they might not be cancerous. So no definite CT evidence of pulmonary metastatic disease in this known case of thyroid malignancy. They had mentioned in thyroid malignancy, but this nodule in a pulmonary nodule in left lower lobe might not be, is not the CT evidence of metastatic disease. This is not the evidence of metastatic disease, what the CT thorax mentioned. And the cholelithiasis with the bilateral perinephric fat, all these things we found. X-ray chest, we found cardiomegaly, as he has undergone twice bypass surgery in past. And the non-contrast CT neck, this is the report already I have told you, 2A, 3, 4, and 6. So in the first visit also he had these things along with the salivary gland metastasis, but the pulmonary metastasis is not yet, no axillary metastasis, no mediastinal metastasis yet after 1 year, 2 months, 4 months, 1 year, 4 months of treatment. So this is CT thorax report. We can find cholelithiasis is also there. And I went with arnica 200 for cardiomegaly, calcium, cholestyrinum 3x, BD, carcinocin, and causticum as usual in 15 days interval. I continued. Course, here we find hoarseness, ultrasound abdomen also he had, adherent slosh, ball, soft calculi, CBD obscured due to bowel gas. So this is the repeated medicine. The same carcinocin continued along with the cholestyrinum 3x and causticum 1m, 2 doses in 1 hourly interval in every 15 days interval. I am continuing. This is the lipid profile was quite normal. His fasting glucose 130 and 161. And this is the all the parameters, LFT, liver function test quite normal. And this is the he is continuing with the person is continuing with us. Now he is 90 years old, papillary thyroid carcinoma. Here also he has given a video, if it is possible.
I think we have only
Is
3
it
more.
audible? Is it audible? Is it audible or not?
No, madam, no.
No.
I think it is better to you say
Okay,
the.
okay. You just see the picture of the look of the patient. He is 90 years old now. He is able to walk 2 kilometers in morning and 2 kilometers in evening. He is continuing his pranayam and yoga continuously every day as a routine, and he is having sound sleep, good appetite, very good appetite. All yoga, pranayam, morning walk, evening walk. He can ascend up to second floor the stairs now at the age of 90. So he is leading a very happy life, very symptom free life for last 1 year 4 months, you can say. And the video he has told like that I am very happy what the energy level was in the beginning in November 2024 when he came. The appetite was very less, energy was too low. He was not able to walk, no morning walk, no evening walk, completely bedridden he was. And now he can do 4 kilometers walk every day. So yoga and pranayam, of course, papillary thyroid carcinoma is his grandson. He has also told the same thing as the audio. This is not also audible, no?
Yeah, we can hear some sound, but even though it's not clear what they are saying, we couldn't get any message from that. Anyway,
Okay,
madam,
okay.
thank you so much. We have another session on 9:30. Thank you so much. You are the you got award for the Woman of Inspiration. Here also you inspired us so much. Thank you so much for sharing your cases here, and I appreciate you as a strong, confident woman. We got you as a speaker of today. Thank you so much. I love you all. Happy Women's Day. Thank you on behalf of IFPH, and thank you all the participants for joining with us. And now I am handing over the session to Dr. P. Shaila, other strong woman. I am welcoming you, Dr. P. Shaila. You're welcome.
Thank you, madam. Namaste.